So when you first get to the clinic, when you come in for your assessment, there's going to be a little bit of a paperwork portion. So I've got a health history intake form that you'll fill out. Then I also have an oral behavior checklist that you fill out, and that just gives me an idea of what a typical day looks like for you, whether you're a gum chewer, whether you play woodwind instruments. If you talk a lot for a living, when I bring you to the treatment room, we'll sit down and we'll have a conversation. So I'll go through your health history really quick. The reason for that is just to make sure that there's no other conditions. So if I need to make any kind of modifications to treatment according to any kind of health conditions or medications you're taking, or if there's sometimes even contraindications to treatment altogether. So I just need to know to be able to make sure your treatment's as safe as possible. And then we do an interview. So I'll have a look at that oral behavior checklist, ask you questions kind of based off that. Then I will move into the more physical assessment. So I start with palpating the TMJ, which means I'm just gonna have my fingers on either side of your jaw. I'm gonna be standing behind you, getting you to open and close. So I wanna know if one side of your jaw is coming forward a little bit before the other one. Following that, I will stand in front of you. Again, I'm gonna have you open and close. This is what is called the mandibular gate assessment. So I usually get people to close their eyes for this, and I tell them, like if you wanna keep your eyes open, that's fine, but I'm standing in front of you watching you open and close your mouth. So I usually tell people it could get a little weird if you keep your eyes open, but you do whatever you're comfortable with. Does it look like you have full range? Do you tend to lean back a little bit and engage your cervical spine whenever you're opening and closing? Does your jaw deviate to one side? Is it interchanging? Is it doing a bit of a zigzag pattern? These things all tell me what could be happening in that TMJ. Moving on from that, I get my stethoscope out. I have a listen to both sides. I know a lot of people are usually a little bit shocked when I pull a stethoscope out for a TMJ assessment, but it does give me a lot of very useful information. I like to listen for popping, clicking, or thud. The other thing that I'm listening for is any kind of like cracking, what we call crepitus, which could be indication of any kind of adhesions in the joint capsule itself. Moving on from that, I will do an assessment of your range of motion. When I'm gauging range of motion for mandibular depression, I use one of these handy tools, and this just measures what your range of motion is. So this little notch goes in your bottom teeth, and then I have you open, and I can measure really quickly how far your range of motion extends to. And that just gives me a baseline, and I can kind of go from there. I usually reassess that after a few treatments to see if it's increased at all. Moving on from that, I will do an assessment for inflammation. The reason why I do that is because if there is any inflammation within the joint capsule, it just makes treatment a little bit different. I have to modify a couple of things just to make sure that I keep it safe and pain-free. What that looks like is a distraction of the TMJ and then a compression. And I just ask my patient whether there's any pain with either one of those, and I do that bilaterally, which means both sides. Following that, I will include anything else that I feel is necessary throughout the assessment. This might look like some range of motion for the neck, if I think that there's involvement there. If I think that there might be any neurological related symptoms, then I can do some neurological testing. But typically, that's what the entire assessment looks like. If you've been experiencing any symptoms of temporomandibular joint dysfunction, then I recommend booking an assessment with me so we can hopefully get to the bottom of things. The link is in my bio. You can click on that and it'll take you to a page where you can find my name and you can specifically request a TMJ assessment.